Welcome back to Mind Matters. I'm your host, Lilly, here to explore the incredible intricacies of our minds. Today, we've got a super interesting topic lined up, something we all experience, but maybe don't fully understand: anxiety, fear, and panic. And joining me to demystify all of this is our brilliant AI expert, Robert. Welcome.
Thanks for having me, Lily. I'm really looking forward to our chat today. It's a topic that touches everyone's lives at some point, and it's important to understand the nuances.
Absolutely. Let's dive right in. We often use words like fear, panic, and anxiety interchangeably, but I know there are distinct differences. Can you break those down for us? What truly sets them apart?
That's a great starting point, and you're right, they are often conflated. The core distinction lies in the presence of a real immediate threat. Think of it this way. Fear is what you feel when there's an actual, present danger, something perceived as a real threat by most people. Imagine you're walking in the woods and suddenly a bear appears right in front of you. That immediate, intense feeling, that's fear.
So fear is right there, in the moment, reacting to something concrete.
Precisely. Fear has very clear components. You might cognitively think, I am afraid. Your heart rate increases, breathing gets fast and heavy, and you feel a strong urge to escape the situation. It's that immediate fight or flight response to a present danger.
Okay, that makes a lot of sense. So then, how does anxiety fit into that picture?
Anxiety, on the other hand, is more about anticipation. It's a diffused, future-oriented state that arises when the danger isn't present or can't be specified. You might worry about a possible future threat, feel chronic tension, or be preoccupied with potential danger, but there's no immediate urgency to escape.
So if fear is the bear, anxiety is worrying about bears when you're safely at home.
Exactly. Or even worrying about that job interview next week or trying to meet a deadline. Your anxiety might decrease once you're out of that specific situation, but if someone remains anxious regardless of the situation and can't cope, that's when we start talking about an anxiety disorder.
And what about panic? Where does that fit in? Is it just extreme fear?
Panic is quite interesting because it shares those cognitive, physiological, and behavioral components with fear, but with an added intensity. A panic attack is characterized by overwhelming subjective feelings of impending doom, a fear of dying, or losing control, or even going crazy. It's a sudden surge of intense fear or discomfort that peaks quickly. Many physical symptoms accompany it, like palpitations, sweating, trembling, shortness of breath, chest pain, nausea, dizziness, chills or hot flushes, numbness, and derealization or depersonalization.
Wow, that sounds incredibly intense. So it's like fear amplified, often without an apparent external trigger?
Sometimes, yes. While a panic attack can be triggered by a feared situation, object, or thought, they can also appear to be uncued or out of the blue. For instance, someone might be happy and excited, leading to a racing heart, which then unconsciously acts as a cue for a panic attack, even though they were feeling positive.
That's fascinating how internal cues can become triggers. Moving on to phobias, we hear a lot about them. What are the main types the DSM-5 recognizes?
The DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, identifies three primary categories of phobias: specific phobia, social phobia, and agoraphobia.
Can you tell us a bit more about specific phobias? What are some common examples?
Specific phobia is diagnosed when a person has a strong, persistent, and disproportionate fear of a particular object or situation that poses little to no actual danger. It's an immediate fear response, almost like a panic attack, but with a clear external trigger. For example, someone might have a severe fear of spiders, known as arachnophobia, or an intense fear of heights, which is acrophobia. People with specific phobias often recognize their fear as unreasonable, but can't help avoiding the trigger.
So if I have an intense fear of, say, clowns, even a picture of one could trigger a response.
Precisely. even mere representations can provoke anxiety. The DSM-5 breaks down specific phobias into 5 subtypes. Animal type, like dogs or snakes, natural environment type, such as storms or water, blood injection injury type, which is a fear of seeing blood or needles, situational type like flying or elevators, and then an other type for things like choking, vomiting, or even fears of clowns.
That's a comprehensive list. And what about social phobia? What does that entail?
Social phobia, now more commonly known as social anxiety disorder, or SAD, is a persistent, irrational fear linked to the presence or scrutiny of other people. It's a fear of acting in a humiliating or embarrassing way when exposed to others.
So, public speaking would be a classic example, right?
Absolutely. Public speaking is a very common example, but it can also include fears of eating in public, using public restrooms, or even just general social interactions. People with SAD often avoid such situations entirely, or if avoidance isn't possible, they endure them with significant distress.
And how do these phobias develop? Is it all about a bad experience?
While a negative experience can certainly play a role, it's more complex than just that. Causes involve a combination of biological factors, learning experiences, cognitive patterns, and even evolutionary influences. From a behavioral perspective, phobias can be learned through direct classical conditioning. For instance, if someone has a severe traumatic experience, like witnessing a severe horse accident, they might develop a phobia of horses, as was suggested in the case study of little Hans.
So it's not just a personal traumatic event, but also something they might observe.
That's right. Phobias can also be acquired through vicarious or observational learning, simply by watching another person react fearfully to something. Imagine seeing someone scream and run from a spider. You might then develop a fear of spiders herself. Even mass media can contribute, like learning to fear flying by hearing about plane crashes on the news.
That's a powerful point about observational learning. It really makes you think about what we expose ourselves to. So, once these fears take hold, how are phobias generally treated?
The primary and most effective treatment option is exposure therapy. This involves gradually exposing the client to the feared object or situation in a controlled environment.
How does exposure therapy actually work?
One common form is systematic desensitization. The idea is that you can't be both anxious and relaxed at the same time. The therapist works with the client to create a hierarchy of fear-inducing situations, from the least scary to the most scary. Then, while practicing relaxation techniques, the client imagines or is gradually exposed to these situations in ascending order. For example, if someone has a dog phobia, they might start by just thinking about a dog, then seeing a picture, then being in the same room as a dog behind a fence, and so on, until they can eventually relax even around a dog. The goal is for them to realize the irrationality of their fear, which then extinguishes it.
So they essentially rewire their brain's response to the trigger. That sounds incredibly effective. What about treatment for social anxiety disorder? Is it similar?
For social anxiety disorder, cognitive behavioral therapy, or CBT, is very effective, often more so than medication alone. CBT for SAD focuses on identifying and restructuring the client's distorted thoughts that contribute to their social anxiety. For example, if someone thinks nobody likes me or people don't find me attractive, the therapist helps them question the validity of these negative thoughts and test them out like hypotheses. Clients are also encouraged to shift their focus from self-preoccupation to others in social interactions.
That's a really proactive approach to managing those thoughts. Before we wrap up, what's one common misconception about anxiety or phobias that you often encounter?
A common misconception is that people with phobias or anxiety disorders are just overreacting or can simply snap out of it. This overlooks the very real biological, psychological, and even evolutionary underpinnings of these conditions. As we discussed, these aren't choices. They're complex disorders with identifiable causes and effective treatments.
That's a crucial point. It's not a weakness, but a condition that can be understood and managed. Thank you so much for shedding light on these often misunderstood aspects of our mental landscape.
My pleasure, Lily. Understanding these differences and their origins is the first step towards managing them and fostering greater empathy.
Absolutely. And that wraps up another episode of Mind Matters. We hope this conversation has given you a deeper insight into the fascinating world of fear, panic, and anxiety. Until next time, keep exploring your minds.